The new year gives us the opportunity to start taking better care of ourselves. If you have periodontal disease, 2012 might be the year that you do something about it. I'm here with Dr. Peck to learn how he can set you up for a great new year. I'm here with Dr. Peck. How are you?
Good. How are you, Maggie?
Good.
Nice
Good
to see you. This is number 5, I think.
Yeah,
All
we're
right.
on a roll.
We're on a roll.
Okay. Would you please tell everybody out there, what is periodontal disease?
Okay. Well, periodontal disease is basically inflammation of the gums, which ultimately leads to bone loss and tooth loss.
Ooh.
And you hate to talk about that at the holidays.
Yeah, it doesn't sound really good.
But, 90% of the population is afflicted with gum disease to one extent or another.
That much? 90%?
That much, 90%. And where people used to hear about plaque, they now call it biofilms. And now what they're finding is that the biofilms in the mouth are related to the biofilms in the heart and other organs in the body. And that's why the treatment of periodontal disease is so important to people's health.
So their oral health is actually impacting their overall health.
Right.
So what are some of the symptoms of periodontal disease?
So here are the symptoms of periodontal disease. Bleeding gums, mouth odors, loose teeth, a dull ache in your mouth. All that is related to periodontal disease. Reddened gums. And a lot of people think that if their gums bleed, that's normal. And what people don't realize is healthy gums don't bleed.
So if you're brushing your teeth and your gums are bleeding, you should be calling your dentist the next day.
You should be calling your dentist the next day. Do you know where we go see your dentist twice a year?
The toothpaste companies,
the toothpaste
right?
companies, right. And really, the bacteria, not to get too technical, but the bacteria that are in part of periodontal disease, you should be getting your teeth cleaned. I hate to say it, guys, but every 3 months. 4 times a year, you should be seeing your dentist. And anybody over the age of 36 to 40 should be seeing their dentist 4 times a year. Our patients in our practice, they're healthy, their gums don't bleed, and they come in 3 to 4 times a year.
As far as periodontal disease goes, does it affect a certain age group? Is it genetic? Who is at risk?
Okay, so there is a hereditary factor.
Okay.
So when a patient comes in who's 25, 35, and they have periodontal disease, my first question to them is, do your parents or grandparents have periodontal disease? Because if your parents have it, chances are you have a propensity to have it also. So if your mom and dad has periodontal disease and you're only 25, you may want to start treating your mouth like you had periodontal disease at a younger age.
Dr. Peck, at what point would somebody need to have surgery for their periodontal disease?
Maggie, that's a great question. First, let's say periodontal disease is never cured. It's arrested. And what I mean by that is that it will always come back. So, which means that if you keep having gum surgery and you keep cutting away the gum, you have this long, ugly tooth, root sensitivity, etc.
Oh, I would think that would be painful.
Very painful. And so what I'm saying is that the answer is not always cut the gums, cut the gums. The answer is home care. So whatever we do in the office, the patient needs to take home and perform at home. What we want to do is not have to always do surgery. Sometimes it's needed.
Right.
But what we have in our office now is a laser. And this laser, there's been a lot of research on it, and what it does is it goes in and basically cleans the infection, modifies the root, so we get new attachment. And there's also materials we put in the gums, Maggie. And basically, not getting so technical, it sends a signal to the body to come on in and repair itself. And there's 15, 20 years of research on this, and we're using that in our practice. And we're getting great results.
But is it painful?
Not painful at all, because we're not cutting the tissue. We're not placing any sutures in. We're using our laser, which many times we don't have to numb the patient up for.
Really?
We remove that inner lining, okay? So we take away the infection. We put in this material. We push the tissue up against the tooth, and we say goodbye.
So Dr. Peck,
Yes.
if somebody was trying to prevent periodontal disease, what would they need to do?
They should go see their dentist 3 to 4 times a year. If their gums bleed, they should call their dentist and not wait for their next cleaning. They should understand that periodontal disease can jump around the mouth. So if they have gum disease on the upper right, and they only clean and take care of the upper right, it could come to the lower left. If you haven't been seeing your dentist 3 to 4 times a year, make that your New Year's resolution.
To find out more about how Dr. Peck can give you a healthier smile in the new year, call him 413-233-4445 or visit his website, mygreatsmile.com.